So tell me about the areas that you hope to see focused on more and more in the future when it comes to treatment, management, understanding the disease.
Yeah. So the one aspect is still that natural history piece. I want that to be prioritized and funded and underscored as being so important. And then within the treatment space, I think that there's been a lot of shift toward gene-based therapies, and I think that's really exciting and has a lot of potential. And so that is an area that I would love to see continue to grow, and to think that not all gene therapies are the same. So how do we optimize it for these diseases? So that's an area that I would love to see grow. And then the other aspect, and this is with all rare diseases, and I think pretty important in this current political climate too, is early diagnosis. So if you have a treatment, in general, we find that it's most effective when you give it to somebody early, either before they start any symptoms or very early in the symptoms. And because these rare diseases can be challenging to diagnose at times, you might not get a diagnosis until they're further into their disease, to the point where the intervention might be helpful, but not as helpful as it could have been. So that's one of the reasons that newborn screening programs are so important, because if you can identify somebody who's going to have a childhood onset of a severe disease that has a disease modifying option for them, if you could identify it at birth or very early on, that can really change the life course for the child. And so that is an area that I want to see focused on. And that is an area that is currently being pushed aside.
What can we do at various stages in healthcare to improve early diagnosis?
So there are, I would say, a couple of things that we can do. So one area for that is going to be really, again, through the newborn screening piece, is to have a very clear plan about how you implement the test. So often what will happen is you test for a sign that the disease is there, and then you have to do confirmatory testing. But because a lot of these diseases might not have onset right early on, some of them might have later onset, like adult onset, for example, or milder disease courses. I think we really need to have a good approach for how we handle the uncertainty that can sometimes come up with these early diagnoses, and that takes a lot of scientific involvement, but also some ethical sides too. That's one area I think we can continue to work on and improve. And then the other piece is the advocacy side of it, is just really reinforcing how important the councils are that help to review the applications, and how important it is that we keep moving forward on expanding newborn screening to capture these diseases early on.